Welcome back to AmourologyEd, where we discuss sex and alternative lifestyle education. This is Nugget. My name is Krista. We are your hosts, and today we're going to be talking about the second part to transgender. So we're going to be talking about gender dysphoria. We're going to be talking about surgeries and transitioning, and then we're also going to be talking about passing. I just want to take a brief moment before we get started and let people know that I have started a Patreon. You can find me at AmourologyEd on Patreon. There are different tiers. The lowest tier starts at $3 a month, which is nothing, guys. Come on. $3 a month would help me tremendously. If you cannot contribute, go on and just follow me. It lets me know that you're listening and lets me know that you like what you're seeing. So thank you so much. So gender dysphoria is a term that has kind of become more mainstream, So gender dysphoria is a term that's become more mainstream, but it was originally mostly used by psychiatrists and doctors to describe the distress that somebody feels and the anxiety and the unhappiness that they feel when their body mismatches their gender identity. And this doesn't necessarily mean that it's just for male or female, but could also mean anywhere along that spectrum as well. You gotta be a little quieter, okay? Be a little quieter. Please. In fact, in 2013, there was a really big change. So I'm going to read this. The American Psychiatric Association released the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-V, which replaced the outdated entry gender identity disorder with gender dysphoria and changed the criteria for the diagnosis. Now, this is really important because it updated that term and allowed people who were diagnosed with this to have access to the healthcare system to pay for treatment that is medically necessary for those people to function and live. Unfortunately, we still do have a very long way to go on this. This was one step in that process, but the majority of people who are wanting to go through some sort of transition with medical intervention don't have access to that healthcare or aren't getting it paid by their healthcare system. This is problematic because, again, this is a medically necessary treatment for these people. Gender dysphoria is one reason why people may choose to go through what they call a transition. And transitioning, it's important to know, is a really multi-step procedure, and it's different for every single person that goes through it. It's not just what people think of as gender reassignment surgery or gender confirmation surgery, but it can be something as simple as changing their name legally, or talking to their family and friends, or changing pronouns, or changing the way they dress or their hairstyle. That can all be part of a transition. On the other end, some people may choose to go through hormones or surgical intervention of various different types in order to help become their true authentic self. Hormone therapy is something that a lot of people choose to do when they're going through their transition. This is just simply taking usually injections of either testosterone or estrogen in order to change the way that your body functions. So this may include growing breasts or growing facial hair, changing the vocal patterns a little bit, although that can be done more so with surgical intervention, changing the width of your body and just the way that you carry your weight. That can all get changed through testosterone. And this can either actually be done pre-puberty or post-puberty. It takes better effect if you do it pre-puberty. And there are things like puberty blockers that you can use to stop one's normal biological puberty that they would normally go through, and then until they can consent to something like hormones, and then they would be able to go through the opposite puberty, basically, of what they were originally going to go through. But you can do hormones at any time. It just changes the potential effect that they have. Gender reassignment surgery or gender confirmation surgery refers to a supervised surgical intervention. And this could be various different ways. It could be with your vocal cords, it could be with your breasts, either breast reduction or breast implants. It could be bottom surgery, which is usually involving the genitalia. And so there's lots of different ways that one can use surgical intervention to change the way their body feels and looks to themselves and then matches their internal identity. It is absolutely important to note that not everybody goes through a gender reassignment or gender confirmation surgery. Not everybody goes through hormones or wants to go through that. And that's absolutely okay. It doesn't make you any less transgender. And there are lots of various reasons why someone may choose not to do that. Gender confirmation surgeries are one way that someone can become what we call passing. Passing just refers to the idea that somebody can go out in public, go out into a public place and be seen as the gender that they intend to be seen as, i.e. a transgender person going into the female restroom and being seen by the people around her as female. That can be really, really important to transgender people for various different reasons. It can be important for the gender dysphoria, for their gender identity, for the self-affirmation, and just the way that they view themselves. It can also really be important for safety. Let's be real, transgender people are a huge target for bigots and violence and acts of crime, hate crimes, and all that like. And so being able to pass as non-transgender can be really, really important to just staying alive and surviving. Not all transgender people feel the same way about this, though. While to some people it's very, very important to pass for those various different reasons that we talked about, others feel like the idea that one has to pass is not very nice to the different spectrums and invalidating to the identities that don't necessarily want to fit into that box or even can afford to pass or can afford to do all of that. Some transgender people think that the idea of passing means that being perceived as cisgender is more important than being transgender, than just being who you are. And there are a lot of transgender people that are really out and really comfortable with people knowing that they're transgender and accepting that identity as part of their persona. However someone chooses to identify is their choice. And I know we've talked about a lot of different conflicting topics in this video, but in the end, what I really, really want to stress is that none of these things are invalid. Whatever people choose to identify with and choose to pursue is absolutely their choice, and there's nothing wrong with that. Well, that is our show for today. Thank you so much for joining me. As always, you can find me at AmourologyNet, at AmourologyEd on all social media, on Patreon at AmourologyEd. You can find Nugget at Nugget the Parakeet on Instagram. And if you like what you see, hit like and subscribe. Thanks so much. We'll see you next time.